COVID-19. Merci de vous joindre à ce point de presse au sujet du nouveau coronavirus COVID-19. Before we begin, a reminder to please place your microphone on mute until I invite you to speak or to ask your question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery, and that button is located on the top right corner of your Zoom video screen. Merci de bien vouloir désactiver votre microphone jusqu'à ce que je vous invite de poser votre question. Veuillez aussi changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de la portion vidéo de l'écran. Reporters with accessibility needs can pin the interpreter Marianne or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler l'interprète Micheline ou suivre la diffusion en direct sur YouTube. Today we'll be hearing remarks from Dr. Vera Etches. Notre porte-parole aujourd'hui est la Dr. Vera Etches. Also on the line for questions is Mr. Dan Chenier, General Manager of Recreation, Cultural and Facility Services, Department of the City of Ottawa. Nous avons aussi Monsieur Dan Chenier, Directeur général des loisirs, de la culture et des installations, pour répondre aux questions des médias. Following the remarks, we will then take questions from the media. Sans plus tarder, je passe maintenant la parole au Dr. Etches. Please go ahead, Dr. Etches.
Thank you, merci. Bonjour tout le monde. Ottawa Public Health supports and agrees with the decision to move Ottawa into the red control COVID-19 zone. It's effective Friday, March 19th, 2021 at 12:01 a.m. So this means just after midnight tonight. The rate of COVID in the community is too high, and we've surpassed the provincial framework's thresholds for red. The rate of COVID in Ottawa is now 49.1 per 100,000 people, and the threshold for red is 40, and it continues to climb. The percent positivity rate has also steadily increased and is now at 2.7%, where the threshold for red is 2.5%. Additionally, the wastewater indicators are at the peak levels that had last been seen in October and January, when there were more restrictions required to bring COVID-19 levels down. So this is a tool that can help us. It provides some validation of the testing-based indicators. Hospitals in our city are currently working at or over capacity to handle the backlog of critical healthcare services and COVID-19 patients. And the number of variants of concern are growing exponentially, and they're leading to the closure of some schools. The higher the level of virus in the community, the higher the risk of COVID-19 reaching more vulnerable settings like childcare, schools, healthcare, and congregate settings not yet reached by vaccinations. And we are seeing these outbreaks in these settings, in multiple settings, increase every day. Plus les niveaux de virus sont élevés dans la communauté, plus le risque que la COVID-19 atteigne des milieux plus vulnérables comme les garderies, les écoles, les soins de santé et les milieux communautaires pas encore protégés par les vaccins. And while Ottawa's limited COVID-19 vaccine supplies have reached some of our community's most vulnerable in long-term care home and retirement home settings, where it is making a difference, I must caution that we are still months away from protecting the majority of older adults and other populations at risk for hospitalization and death. Only about 30% of people in the community over age 80 have been protected. And although vaccination efforts are accelerating with every shipment received, this doesn't happen overnight. Ottawa Public Health remains, and all of us remain, in a pandemic mode. The earlier we act together, the more effectively we'll reduce the rates of COVID-19, and the sooner we can move back to a less restrictive zone. Plus tôt que nous agirons ensemble, plus nous réduirons efficacement les taux de la COVID-19 et plus tôt nous pourrons adopter une zone moins restrictive. If the levels rise, more harsh restrictions for a longer duration would be required, which is shown by evidence from around the world and experiences in Ontario and lessons learned here in Ottawa over the last year. Earlier intervention means less restriction in the longer run. Ottawa has never before operated under this red control zone from the latest provincial framework. We went from orange restrict into the gray lockdown with the rest of Ontario in December. We did reach the provincial red zone threshold with 5 people indoors and the same number outdoors as in orange, 25 people outdoors. Religious ceremonies and gatherings, including weddings and funeral services, are still allowed, but with more restrictions, where physical distancing can be maintained to 30% capacity of the room indoors or 100 people outdoors. Most businesses will remain open. This is not a lockdown. Restaurants and gyms can stay open. However, these are higher risk settings, and places where people are in close contact without a mask is where COVID transmission is higher. And there is now a capacity limit of 10 patrons seated indoors, and for gyms, a maximum of 10 people in indoor areas with weights and exercise machines, or for classes with physical distancing maintained at all times. This is hard. Individual and team sport training is still allowed. However, games, scrimmages, or other contact are not permitted, and indoor cinemas are required to close. We know moving into the red control zone is going to be very difficult for many business owners, especially restaurants and gyms. No, people have worked hard to keep businesses open. And while capacity limits can be frustrating for business owners, we know further restrictions are needed to limit transmission where people come into close contact with each other. So I want to encourage people in Ottawa, now more than ever, support local businesses by ordering takeout, using outdoor spaces and patios, use curbside pickup, and help our friends, our family, and our neighbors keep their livelihoods going in these difficult times. By moving to red control now, we're sending a signal that more action is required to reduce COVID levels in our community. We need to do what we know has worked for us in the previous months. En passant à rouge contrôle maintenant, nous envoyons un signal clair qu'il faut prendre d'autres mesures pour réduire les niveaux de COVID-19 dans notre communauté. Nous devons faire ce que nous savons a fonctionné pour nous au cours des mois précédents. Limit contacts and interactions. Stay home as much as possible, and especially if you're sick. Wear a mask, wash your hands often, and get tested if you think you may be infected. Doing these things will help decrease the level in the community to avoid another lockdown. We are now days away from the start of spring. We've lived through an incredibly hard year. I know I'm asking you to do more hard things again. And we are seeing our most vulnerable residents getting protected by vaccination. We will get to a place where more older adults are protected by vaccination, and we can revisit these frameworks and these controls. Spring will look different than last spring. Vaccination and continuing to follow the public health measures will keep us safer and will lead to fewer deaths and hospitalizations as we build up immunity in the population. We can do this. I know we can. So please keep going, and please take care of yourselves and each other. Merci, miigwech. Thank you.
Thank you, Dr. Etches. I will now invite each agency in alphabetical order to ask their question. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question et une question de suivi. We'll now start with CBC Ottawa. Kimberly Molina, please go ahead.
Thanks. Can you guys hear me okay?
We can hear you great.
Perfect. Okay, so we're going into red tomorrow. It seems like not a lot of advance notice. I know we sort of had the idea that we were probably going into red within the week, just a couple of days ago. But we're seeing some concerns from businesses, restaurants, bars, specifically, especially complaining about things like, wasted food, canceling server shifts. So what's your response to that?
Yes, this obviously is very hard for restaurants and bars when the food's been ordered and staff are scheduled. And so I know there's work underway to look at how that food can be purchased back from restaurants and bars. And I do encourage people to support these venues by taking out food, by using outdoor spaces, doing curbside pickup. I think this obviously is challenging. In the context, we know where the earlier we act, the better we can get things back under control as well. So I appreciate that people do need notice, and this is a difficult time.
So in terms of that notice, was there any possibility of waiting until, say, after the weekend or mid next week, or what was the reason for today specifically, or I guess, pardon me, today at tomorrow at midnight?
Oh, well, when I spoke with the province over the last number of weeks, when I've been for a couple of weeks at least seeing the danger here with the indicator in the wastewater rising like a rocket a couple of weeks ago, and then knowing that this can follow, that there's more COVID in the community. I was talking with the province about how can we move as quickly as possible when we do reach those thresholds. On Tuesday, in speaking with the Chief Medical Officer of Health in his office, we confirmed we're in the red, and we talked about timelines for implementation. Knowing we want to give notice to business, ideally 2 days is what we'd like to aim for as a minimum. The process then I was open if we can implement earlier, that's better for transmission control, but there's a process, of course, that needs to go through in terms of cabinet approval, regulations being drafted, and so I think this is where we ended up in terms of it was able to move more quickly.
And I just wanted to quickly ask, you mentioned the word lockdown a couple of times in your opening remarks, and the fact that Ottawa's numbers are rising quite quickly, especially as you mentioned, the variants of concern are rising exponentially. Do you see Ottawa or even the province going into another lockdown, and how quickly do you expect that might happen?
Well, I'm making this recommendation today and advocating for everyone in Ottawa to do their part so that we don't get there. It's not inevitable. Absolutely not. We do not have to get into gray territory. If we go back to what works, be careful about how we wear a mask. Make sure we're wearing a mask with people outside of our household. Thinking about the socializing we do and the mixing of children in contact sports and before and after school, all of these things we pay a bit more attention will bring the transmission levels down. So no, I don't think anything's inevitable. And we've seen before in Ottawa that earlier intervention helps us keep the curve lower and helps us turn the curve.
Thank you. Next question will be City News. Eric O'Brien, please go ahead.
Hi. I'd actually just like to follow up on that. Now, we also heard from a lot of local businesses today, and talking about the needing time to prepare for the weekend with food and just overall preparation. You said it yourself, Dr. Etches, on Tuesday that they also need time to prepare. So if I'm understanding correctly, there was a sense of urgency to move us into the red before the weekend.
I felt a sense of urgency that we need more, measures in place to turn the level of COVID from rising into, declining again for the last little while. And so, yes, we know, like when we see that wastewater go up, it's an early signal. The faster we act, the better. And we have heard from businesses. I do appreciate the idea of notice. It's why I've been sending that message, that we're close to red. When I could see we're passing all the thresholds and talking with the province on Tuesday, this is coming. So I think we need to support businesses who may have purchased food and find ways, to provide assistance.
Now, just as a follow-up, do we know the percentage of cases that are spread in local businesses and in restaurants? And can we possibly get that information?
Like usual, the best information we have about this comes from our case and contact management team, where we try to identify the source of people testing positive for COVID-19. We're not always able to identify the source. People have many different activities they've undertaken. We don't always know where the source is. We can say the biggest category is spread within the household. So about 40% of people testing positive have a close contact in the household who was positive, but it started somewhere else. It was brought into the household. And we are seeing people who have tested positive working in many different sectors, including cinemas, including restaurants, including bars, including many types of workplaces. So we know the opportunity for transmission is there then when people are in close contact without masks. And those situations, especially indoors, do occur in the types of businesses affected by the measures today. So the outbreaks are listed on our dashboard. You can see the number of outbreaks confirmed. That's only part of the picture. It doesn't capture all of the times that there's been exposure with somebody positive in these environments. And so there could have been onward transmission that's just not linked. It just doesn't show up in our data.
Thank you. Our next question will come from CTV News. Josh Pringle, please go ahead.
Thank you very much. Dr. Etches, just going back to what you were saying about moving Ottawa into the red zone, and it sounded like you were open to do it earlier than today if possible. Just wondering, what was the urgency to move Ottawa into the red zone before the weekend? And at the same time, with hospitalizations not as high as they have been, ICUs right now, there's 6 people in ICU. What's the goal of moving into the red zone when the hospitals don't appear to be overwhelmed?
The goal of moving into the red zone is to move us from a situation where COVID levels are rising and put us back into a more stable state where we can keep control of the COVID levels in our community. Because as they go up, where we are now and beyond, we start to see more outbreaks, which we are. We start to see more schools are closing. In the variant of concern is a factor, and what I see is that we aren't there yet in terms of being able to have an older adult population that's protected with vaccination. So this need to go into restrictions will change. We will get out of this, having to apply this kind of framework once we have higher levels of immunity. But when I look at hospitalizations, 25% of our hospitalizations since December have been in people in their 50s. People in their 50s are not due for immunization for at least a couple of months. So we're not there yet in terms of being able to rely on that vaccination program. It will come. But at this point, we still have to keep control on the level of COVID in our community, and it's getting out of control with the rise we see.
And my follow-up question, just talking about schools, Ottawa Public Health is now requiring students identified as a close contact of a variant of concern should stay home for 24 days instead of 14 days if they do not go for testing. Why did OPH institute the new guidelines, and are you seeing families not going for testing and just waiting the 14 days before returning to school?
So the situation is where someone's tested positive for COVID-19 in a school setting, and it's been a variant of concern, and they're high-risk contacts who then may have been exposed to that COVID-19. We need to give them the period of isolation where they could be incubating. So that period is 10 days. And then, up to 14 days, sorry. And then sometimes we see children have asymptomatic infections. And so that means we want to be tight on that. We want to make sure that it isn't someone with an asymptomatic infection who's going back into the school to continue to pose a risk of transmission. So if people don't get a negative test at that point to show that they didn't end up developing the infection, we are asking them to stay home for the infectious period beyond that. So it's another 10 days. In fact, most people, I believe, are going for testing. So people get the test and then they know they didn't pick up the virus and they can go back to school. Testing is available still, online booking appointments within the next day. Rapid turnaround times we're still seeing from our labs. So this is, what we encourage is that people make sure this isn't adding to the spread in our community.
Thank you. Our next question will be global news. Craig Lord, please go ahead.
Thanks very much, Dr. Riches. I've been hearing from some movie theater operators who are obviously upset and a little confused that they have to close entirely while restaurants and gyms can stay open with limited capacity. So can you maybe explain a little bit what the reasoning is behind movie theaters having to close fully, but restaurants, where people are eating, drinking, and having a lot of conversation without masks are allowed to stay open?
I don't know all of what went into creating what's allowed and what's not allowed under the provincial framework. So I think questions about the actual measures under RED are probably best directed to the province. I'm open to conversations about what those measures are, and ultimately it's not me that decides, but conversations with the province. We do need to adapt these measures as we get into levels of immunity from the virus through vaccination. So I think it's worth revisiting as we go forward.
Sure. I guess maybe just a general question then. How would you, in your opinion, kind of compare the risk of transmission at a movie theater? Is it higher or lower than a restaurant or a gym?
So it depends. Okay, I can give you like this. The risk is going to be higher when people are closer together without a mask on. So and for a longer duration of time. So if someone is having a quick meal and they otherwise wear their mask when they're not eating, that may be less risk than somebody who's keeping their mask off in close contact, that same distance in a theater where it's a longer period of time. But it will vary. So it's very difficult to make a judgment about each specific instance and what's happening. We have to go back to the basics in terms of you're going to decrease your risk for COVID transmission by limiting your contacts, wearing a mask when you're in close contact with people outside your household, and keeping distance. Being outside is better than inside. Those are the principles to follow. I think the kinds of things we've supported as Ottawa Public Health previously are to take an approach where you look at the capacity of a setting. So how big is the restaurant? How big is the cinema? These kinds of approaches where we think about the ability of places to maintain physical distancing between people is probably that's a fundamental piece. And so I think these are the kinds of things we could look at in terms of future modifications.
Thank you.
Thank you. La prochaine question vient du journal Le Droit. Julien Paquette, c'est à vous.
Oui, bonjour. Ma première question, je crois que vous y avez touché un petit peu en anglais, mais je m'intéressais aux hospitalisations, en fait. Vous avez mentionné qu'il est important de réduire le niveau de COVID pour protéger certaines institutions ou comme les services de garde et tout ça, mais je me demandais c'était quoi encore à ce point-ci les risques qui existent par rapport à nos hôpitaux. Est-ce qu'on est encore dans une situation où on peut les services hospitaliers peuvent être débordés ou avec la vaccination des personnes plus âgées, on commence à en être protégé?
il y a quelques questions là.
Oui.
Concernant l'état des hôpitaux, ils sont occupés. Ils sont pleins avec leurs patients. Et c'est parce qu'ils ont des surgeries pour les maladies cardiaques, pour les cancers. On continue d'essayer d'améliorer l'attente pour ces processus. Et c'est important. Ils sont débordés encore. C'est pas complètement avec les patients qui sont positifs pour COVID, bien sûr, mais c'est un environnement où ils ont leur travail et c'est difficile maintenant. L'autre point que j'ai fait en anglais, c'est que la population hospitalisée était les gens qui ont plus de 50 ans et plus. C'est pas juste les personnes qui habitent dans le foyer de soins de longue durée ou les maisons de retraite. En fait, la majorité de la population hospitalisée depuis décembre, plus que 80% vient de la communauté. Il habite dans la communauté. Alors, cette population dans la communauté, c'est pas protégé par le vaccin maintenant. Nous sommes au début de fournir le vaccin pour les personnes plus âgées. Bientôt, ça va être les gens moins de 80, mais on continue avec les personnes qui ont plus de 80 ans. Mais ça prend temps d'avoir la quantité de vaccins pour protéger les gens dans leur cinquantaine. Ça prend temps et c'est une population à risque pour les hospitalisations.
Parfait. Et l'autre question que je me posais aujourd'hui, à voir la façon dont, depuis un peu plus d'1 an maintenant, on passe d'un niveau de restriction à un autre. On diminue les restrictions, puis quelques semaines plus tard, le niveau COVID augmente. Est-ce qu'on a un point où on commence à se demander si c'est pertinent justement d'augmenter, de réduire continuellement le niveau de restriction? Je ne sais pas si vous comprenez ma question.
Je pense pas. Je m'excuse.
Non. Est-ce qu'on est en train de se questionner sur la façon dont on approche le niveau de restriction à voir que quand on les réduit, les restrictions, le nombre de cas augmente? Est-ce qu'on va chercher peut-être plus une certaine stabilité dans les mois qui suivent pour éviter une troisième vague, dans le fond?
Je pense que je comprends. Je peux juste répondre et voir, Vera. Maintenant, parce que nous n'avons pas une population plus âgée qui est protégée par le vaccin, on a besoin d'utiliser cette mesure, je ne sais pas le mot pour ça en français, le système de la province, le orange, rouge, gris. Mais bientôt, j'espère, dans les prochains mois, on peut changer ce système, on peut réviser les mesures dans les différentes catégories, par exemple, peut-être, quand il y a plus de protection pour les populations vulnérables dans les communautés. Alors, oui, je voudrais arriver, et je pense que ça va arriver, un monde où c'est plus stable pour les entreprises. Parce que ça, c'est difficile pour les entreprises, bien sûr.
Merci beaucoup.
Thank you. Our next question will be from On the City from the Burbs with Sue Sharing. Sue, please go ahead.
Thanks very much. And I apologize if someone's already asked this because I'm just getting in. I was on a different Zoom. I'm curious about the red zone in that you were saying last week that it's mostly sports events. So this seems to be affecting a whole lot of things that we haven't heard are big problems. So I'm hoping Dr. Etches can address that.
Yeah, so I didn't mean to leave the impression that only sports events were driving transmission. Sports events are contributing. However, there are many different types of workplaces where we are seeing people test positive, and being in those environments while they're infectious. There's always that element of socializing with people outside of our household is where we let our guard down, where we're in close contact with people without masks. So, restaurants and gyms are environments where people are in close contact with each other without masks. That is an environment where COVID can be transmitted. So some of the businesses affected, are there because we see that as the risk. But this, again, the specifics of what's in red, and it is set by the province.
And as a sort of follow-up, when you announce these sort of things, are you still getting the same sort of horrific feedback from the public that you were getting at the start?
Look, I understand this is a really difficult kind of thing to imagine, having to have more restrictions, particularly for the businesses. It's not a place that I wanted us to get to.
It's not your fault.
Yeah, well, I take responsibility for indicating when we need to have more control over COVID-19 in our community, and we see that. I want people to appreciate that we have the opportunity to avoid a lockdown by bringing the levels back under control.
But does that mean you are getting some? I mean, I wrote a column like "Wear your mask, idiot," and I got tons of hate mail. Are you still getting that sort of thing?
Yeah, I definitely don't. I don't want to blame anybody for feeling fatigued and frustrated with the situation. It is tiring. Like we are living under difficult circumstances, and some are more affected than others. So I think the things I'd like people to take away, because there are people say, well, why can't you just vaccinate more people? We'd love to do that, but we can't when we don't have the vaccine. So I think there's some information to share for people to understand the context. Is we're working, that vaccination program is the top priority. We're using the vaccines as they come in. We just aren't there yet in terms of having enough to be able to back away from some of the restrictions that would keep COVID levels more under control.
Well, it doesn't surprise me that you're being very kind, but thank you for the answers.
Thank you, Sue. Our next question will be from the Ottawa Citizen. Jackie Miller, please go ahead.
Hi. You have mentioned the threat that the variants pose to schools, and you recently introduced some measures to help prevent COVID from getting into schools. I'm wondering what measures you might introduce to further protect the students and the staff once they're in the school. For instance, Peel has recently said that at their schools, the students should be eating outside, or else if they are eating inside, open the window every other row. Teachers have to eat by themselves, no congregating outside. Teachers also are required to wear goggles now.
I probably need to check with my team, but I know Ottawa Public Health has been recommending face shields or goggles as protection for workers who are in close contact with students. I think this has been a routine recommendation of ours for some time.
Okay, this is for all teachers, just the recommendation. Can I move on to the question of vaccines? Could you give people some guidance now that more people are getting vaccines and some older people on what type of household mixing socialization can go on between two people or a number of people who've had their vaccines, or do they have to wait for the second dose and then a month after that? And some of the older people are saying, when can I hug my grandchildren, as children aren't being vaccinated?
Yes, absolutely. So vital to get back to more normal interactions, and we don't have the guidance on that yet. People are getting more and more information all the time. It's why you see the National Advisory Committee on Immunizations updating their recommendations regularly, because this is being studied in the real world. So we do have good information now that the first dose of the vaccines that we're using in Canada provide a good level of protection. And we are, speaking with the province and the federal government about what does this mean then for the guidelines. And I think we see others moving to some lessening of restrictions in a situation where someone is fully immunized, and fully immunized meaning 2 doses. So I think your question, should be answered in the coming weeks to months, but I don't have the answer for you right now.
Thank you.
Thank you very much. Our next question will be from the Ottawa Sun, Bruce Deichman. Please go ahead.
Hi, Dr. Etches. I recognize you don't have a crystal ball, but I'm wondering if, given what you know about the effects of being in different zones of restriction, and given where the numbers are now, and given what you know about people's compliance, how long do you think this red zone visit will last?
Well, I think 2 weeks is what we're looking for, to be able to see that the actions we take today show up in less transmission in 2 weeks. And so that's the point in time where we'd be discussing whether it's needed to continue or not, based on whether things are still rising or what's happening at that point.
But that seems like a reasonable possibility, 2 weeks, that we might get back to orange.
I hope so. If people have been hearing me for the last couple of weeks that we're close to red and we need to adjust and close the gaps in our behavior where COVID could be passed on, then that means, yes, we could see that action has turned things, and that would show up also within 2 weeks. If we start to close those gaps now with this move into red, then it may take a little bit longer to see, but I'm hopeful about that.
Thank you.
Thank you, Bruce. La prochaine question, nous passons à Radio-Canada. Maman Afou, c'est à vous.
Oui, bonjour, Dr. Etches. Je vais vous reposer un petit peu les mêmes questions que mes collègues là, mais ça va être en français cette fois-ci. Ma première question, ce serait, qu'est-ce qui vous a poussé à précipiter le passage à la zone rouge pour Ottawa? Comme les collègues l'ont dit, les restaurants n'étaient pas encore vraiment prêts là, ils avaient beaucoup de nourriture en stock. Et aussi, dans ce que disait mon collègue aussi, par rapport à, vous espérez quand qu'on pourrait revenir au orange?
Oui, pour la première question, c'était mon concern que c'est possible d'avoir les restrictions pour un temps plus court si on fait les différences, le changement plus tôt. Alors, c'est important de réduire la transmission, et c'était depuis quelques semaines que j'ai expliqué, ils ont des indicateurs dans le eau usée que le niveau augmente. Maintenant, le niveau de COVID-19 augmente. Et c'était une discussion avec la communauté qui nous sommes proches. Et je pense que c'était mardi, quand j'ai eu la discussion avec la province aussi, j'ai décrit que c'était cette semaine, nous sommes en rouge, et c'était possible d'avoir l'action plus vite ou non. C'était une question pour la province parce qu'ils ont leur processus d'avoir une discussion avec le cabinet, et aussi le processus pour le règlement. Alors, c'était une décision de la province, le processus de la province pour déterminer si c'était possible d'avoir l'action plus vite ou non. Mais c'était, évidemment, c'était possible. Et la deuxième question, c'est quand on peut retourner au orange, et j'espère que c'est dans 2 semaines, parce que nos actions, nos comportements aujourd'hui déterminent la situation dans 2 semaines. Alors, on peut changer le niveau avec nos actions, et on va répéter le processus déterminer le statut dans 2 semaines.
Et mon autre question, ce serait par rapport à la vaccination. Hier, du côté de l'Outaouais, on demandait aux personnes d'appliquer pour des postes, notamment des postes en administration, mais aussi des vaccinateurs, des injecteurs, parce que on voyait que la vaccination de masse allait demander plus de personnel. Donc, est-ce que vous, ici à Ottawa, aussi, est-ce qu'on a le personnel nécessaire pour effectuer la vaccination rapidement? Et est-ce que c'est la même problématique qu'il va y avoir à Ottawa aussi?
Nous avons le même défi de créer un programme de vaccination avec beaucoup de nombre des employés, de personnel, absolument. Je pense que c'est correct maintenant que la ville d'Ottawa a augmenté le personnel par 1000 personnes. Et je pense que c'est un processus couramment. Et après, les personnes commencent, ils ont leur entraînement, le système de soutenir les gens avec leur accès au système de technologie, les choses comme ça. Et c'est vraiment une grande tâche qui est en place maintenant.
Mais ma question serait, d'ici les prochaines semaines, quand il y aura une accélération de la vaccination, est-ce que vous risquez de faire un appel aussi, comme l'a fait hier le CISO, pour recruter plus de gens d'ici les prochaines semaines?
Je ne sais pas parce que nous avons des centaines de médecins de famille qui aussi aident nous. Et je pense que on a un processus maintenant de soutenir les cliniques, mais s'il y a plus de vaccins disponibles, on va utiliser le vaccin avec plus des immunisateurs. Alors, on verra.
Merci.
Merci beaucoup. La prochaine question, TVA Gatineau, Ottawa. Avons-nous Louis-Charles Poulain?
Oui, je suis là. Bonjour, Dr. Etches. On parle en Ontario d'une 3e vague. Est-ce que vous considérez qu'Ottawa est au début d'une 3e vague? Est-ce qu'on peut affirmer ceci et quelles sont un peu les projections quand on regarde vos indicateurs pour les semaines à venir?
Oui, c'est intéressant à Ottawa. Notre expérience avec la pandémie, c'est plus que il y a quelques vagues moins grandes que le 2e dans la province. Alors, pour nous, c'était, oui, une autre vague maintenant. Nous sommes dans une autre vague. C'est le 3e ou on peut dire peut-être le 4e si on compte juillet ou le 5e. Alors, je m'excuse, mais c'est plus comme beaucoup de différentes vagues, mais oui, ça augmente maintenant, c'est une vague. Et je pense que c'est possible de tourner la courbe pendant les 2 semaines prochaines.
Est-ce que de votre côté, vous remarquez dans vos enquêtes, est-ce qu'il y a des gens de Gatineau qui sont reliés? Est-ce que vous avez peut-être un message? Est-ce qu'il y a des gens de l'Outaouais qui traversent à Ottawa? Puis est-ce que vous avez un message pour ces gens-là?
Comme d'habitude, je reconnais que nous sommes une ville, les 2 côtés de la rivière. Et encore ce matin, j'ai discuté la situation avec mes collègues en santé publique à Outaouais. Nous avons des tendances vraiment similaires. Alors, c'est important à les 2 côtés de la rivière de faire les actions qui réduisent la transmission de la COVID-19. Et c'est vraiment la même chose. Les 2 côtés, c'est de limiter nos contacts étroits. Je pense à Outaouais, c'est plus strict. Hein? C'est interdit d'avoir de socialisation dans les foyers, par exemple. Mais les mesures de limiter nos contacts étroits, les choses comme ça, c'est le même.
Donc, vous dites qu'on entre vraiment dans une nouvelle vague présentement. C'est le début d'une nouvelle vague, c'est bien ça?
Oui, oui.
Merci beaucoup.
Merci beaucoup. That is all the time we have today. Ceci conclut le point de presse aujourd'hui. Merci à tous. Have a wonderful day.